From a station working for you, this is WRTV News at 5:30, streaming now.
Now at 5:30, healthy eating at all income levels, how the Indy Winter Farmers Market is working to make it affordable to have access to good and fresh food during this pandemic. And working together, the Christmas Nights of Lights at the State Fairgrounds and the WRTV Toy Drive. Kevin is live as the display kicks off tonight and explains how you can help kids in need this Christmas. Lindsay.
At the top of our lineup today, cruise ships are hoping to get back at sea, but can they do it safely? What experts say should be considered before using mock cruises to test the waters. Interest is growing in weight loss surgery. We find out why doctors say it's less about image and more about survival during the pandemic. And new concerns over protective equipment for hospital workers, why some gowns may be giving them a false sense of security.
And now first at 5:30 here, as we navigate through the pandemic, health and wellness are top of mind for almost anyone, and that includes eating well. WRTV's Kelsey Anderson shows us how the Indy Winters Farmers Market is working to bring healthy food to Hoosiers and explains how this is something that you can experience for yourself this weekend.
Tomorrow morning and every Saturday through April, this room will be filled with about 45 vendors hoping to help keep Hoosiers healthy this winter.
Facilitate wellness in our communities to individuals, families, and communities by increasing access to local food.
Danielle Guerin is the market manager for the Indy Winter Farmers Market. This market has been going on for 12 years. Amid the pandemic, Guerin says things look a lot different.
So typically in normal season, we have about 65 vendors in here at one time for a season. This year, we're only doing about 45 vendors. We have one-way entrance and exit, so entrance is one door, exit the other door.
Of course, masks are required inside the Circle City Industrial Complex to keep everyone safe and healthy. But they also hope their fresh products aids in the community's health and wellness.
Local food is important, healthy is important. Your body needs those things to help. You get sick, you need to have good food coming into your body and into your wellness.
Their mission continues by offering a triple match for SNAP benefits.
So if you come in with an EBT card or your pandemic EBT card, which is the white card that most schools are sending out for their kids, we'll triple match that. So if you swipe your card for $20, it'll turn to $60. So you'll get $20 extra in SNAP benefits, then also $20 in Fresh Bucks, which is the Marion County Health Department program that allows you to purchase fresh fruits and vegetables.
Guerin says in their first week, they saw about $1,000 in SNAP purchases. Larry Jones is the owner of the CCIC and says he's glad they can be a part of this important cause.
It's just part of the community we try to have here at the Circle City Industrial Complex. You know, this is one more way that we can do things that kind of benefit the greater neighborhood. We have the space to do it. They can operate safely. Like I said, the Winter Farmers Market Bunch does a lot to keep social distancing, keep things set up well.
The farmers market opens each Saturday at 9 a.m., but that first hour is just for senior citizens and people who are in the high-risk community for contracting COVID-19. Working for you, Kelsey Anderson, WRTV.
Well, look at this beautiful sunset over DePaul University right now. That sunset at 5:31 this evening, setting on a fairly nice weather day. We had plenty of sunshine today. However, it was a little chilly. Those temperatures just peaked into the mid-40s. Usually we're in the mid-50s still this time of year. And overnight tonight, we are dropping off quite a bit. We'll be in the 20s by tomorrow morning, so it's going to feel very chilly outside to start your Saturday. Behind that cold air, we have a warmer air mass that's moving in, and that's also associated with this low pressure system. That's going to bring us showers and maybe a thunderstorm by Saturday afternoon and overnight into early Sunday morning. Along with this showers and storms, we also have the potential of some very gusty winds. So we're going to see those sustained winds about 15 miles per hour. Those gusts, though, will be close to about 40 miles per hour, especially overnight. So here's your Saturday planner. We're starting fairly nice the first half of the day, and then by the early evening, that's when we're going to start to see that showers develop across the area with the bulk of the system moving in overnight. So Saturday night, overnight is going to be a wash. Windy conditions will kick up as well. We'll continue to see some wind on Sunday, maybe a spot shower in the morning, and then Monday is when everything starts to clear out.
Pharmacies have agreed to distribute free coronavirus vaccines once they're available. It's a part of a deal federal officials reached with chain drugstores and grocery market pharmacies across all 50 states. The goal is to make getting a COVID-19 vaccine like getting a flu shot. And while we're waiting for a vaccine to be approved, an expert tells us we need to work on building public trust in it.
People have to understand the process, and they have to be confident in the process.
Daniel Solomon is the director of the Institute for Vaccine Safety at Johns Hopkins. He says it's important that people know there's science and evidence driving the development of vaccines along with external reviews. He thinks there's an issue with the framing of Operation Warp Speed. It was intended to say a COVID-19 vaccine is a huge priority, but the name has been misleading.
The problem is that people tend to have less trust and confidence in newer vaccines and newer biologics. And by emphasizing the speed, it gives the impression that corners are being cut when in fact that's not the case.
He says another problem is that people don't fully understand the risks around COVID. Even if people believe the vaccine is safe, if they don't think the disease is serious, they're unlikely to get the vaccine. To convince people to change their minds, he says who the message comes from is critical.
You really need to individually tailor your messaging because what those concerns may be are very different among subpopulations. How to talk about it is very different, and who should talk about it because who those trusted sources are.
Even before the pandemic, the World Health Organization declared vaccine hesitancy a global health threat. Our expert says among the reasons is a lack of trust in government and health officials and the spread of misinformation online. The head of President-elect Biden's Coronavirus Advisory Board says there's no plans to shut down the country. Dr. Vivek Murthy says instead the plan is to zone in on specific areas. That will include a series of restrictions driven by case numbers. That also means those restrictions would apply to certain zip codes and not the entire country. Up next in our lineup, some cruise lines are recruiting volunteers to see if they can safely sail again.
The question is, should we be having this conversation at all?
Health experts weigh in on the idea of mock cruises and the changes on board. The first cruise to the Caribbean since spring, it's not going well. Several people have tested positive for COVID on board.
The ship had a very rigorous testing schedule, more rigorous than what some of the big lines are planning to do when they come back in a few months.
It's just so disappointing that this has happened because everybody had their hopes up high and we can't see anything more that they could have done. It's just such a horrible virus. It just gets everywhere, even with the constant testing.
Seadream had hoped to be a model for returning safely to cruising.
And really, if they can demonstrate we had a case, we acted immediately, and there were no further cases, that would provide much more confidence in the cruise industry.
Global communicable diseases expert Jill Roberts talked to us about the idea of larger cruise lines holding mock cruises. Royal Caribbean had thousands of people volunteer to see if they can safely sail without any virus outbreaks. Roberts doesn't think now is the time, though, to be having the conversation.
We're seeing coronavirus doing what, unfortunately, we thought coronavirus would do, which was resurge in the fall. So we are having a conversation about an option, cruising, right, which could put people at risk of losing their lives. And so I think it's unfortunate that there is so much interest, really.
She also says masking would be hard to enforce on cruises with constant eating. And as we're learning, even with rigorous testing before and during the cruise, it is possible to have outbreaks. It can take several days after contracting COVID to test positive.
But by that point, the damage has been done. If they've traveled all over a ship and interacted with tons of different people who will in turn interact with different people. And so truly, yes, you can quarantine. Yes, you should. You should get those people off the ship if you can. But remember, the first time this happened, we had ships sitting off of shores of countries that refused to take them. So there's no reason why we wouldn't have that actually happen again.
Ultimately, Roberts thinks it would be safer to cruise again when vaccines are available. Being a private industry, cruise lines could require proof of vaccine before accepting passengers. Ahead in our lineup, concerns over the coronavirus have more people considering weight loss surgery. What doctors think you should think about before going under the knife. For months, many of us have been doing what we can to keep ourselves and our families safe. Patients with COVID who are obese can fare far worse as they fight the disease. As Dan Grossman shows us, this has led to a spike in people seeking out weight loss surgery.
In a year of change,
that's our COVID greeting.
Right?
You look amazing.
a lot has happened since Dr. Michael Snyder and Amanda Kynes-Phillips last saw each other.
The reason I love working with you so much, first of all, I just like talking to you, but also you have so much positivity and really driven by like faith and your focus.
It was July when Amanda was 55 pounds heavier, unhealthier, unhappier.
You don't truly realize how addicted to food you are until you can't have any.
With the help of Dr. Snyder, Amanda got a mini gastric bypass surgery to help with her weight. It has become a popular option among those who battle weight since COVID can disproportionately affect people who are obese.
All 4 surgeons in my practice are really at capacity.
Dr. Snyder says for weeks, more people have been gravitating towards his practice for bariatric surgery as a way to improve their health. So if they get COVID, they can have a better chance at survival.
It's been shown that people do worse with viral infections and infections in general when they're obese. And in addition, the success of a vaccine is limited in people that are obese for any viral vaccine historically.
In an August study, the Cleveland Clinic found patients with a body mass index of 30 or higher were found to be at a significantly higher risk for severe COVID-19. And those with a BMI of 35 and higher had a dramatically increased risk of death.
Obesity is really a pro-inflammatory condition, and we think it really affects what's called your T cell response, your ability to appropriately attack infection.
The study also found that when patients with obesity lose at least 5 to 10% of their weight, their risk of cardiovascular disease drops and their survival rate improves.
I've just been blown away.
For Amanda, that means being there for her children.
I have 2 small daughters that I need to be there for them the rest of their life and to be the best mom that I can be. To me, it's a life-changing tool.
Some might fret at the thought of invasive surgery, but Dr. Snyder says when it comes to it, the chances of complications from weight far exceed those from surgery.
When you have significant weight issues, you're probably going to die from those. And that's just the reality.
For my health, for my children.
I'm Dan Grossman reporting.
And welcome back live to the Indiana State Fairgrounds. Look who's landed.
On Dasher, on Dancer, on Nitro.
On Nitro. Nitro's on the move because we're going to give the actual reindeer a little break here. That's fancy footwork. All the pieces of the puzzle are coming together for the 20th annual RTV6 Toy Drive. Let me mention this. December 11th at the Indiana Farmers Coliseum will be the Teddy Bear Toss. It is a fun event. There will be about half the number of folks at the game, but when the first goal is scored, you throw the teddy bear on the ice. In all, we estimate about 25,000 teddy bears have been donated to the toy drive over the last 4 years. This will be the 5th year for the teddy bear toss. Elsa is relaxed right now. Doesn't have any flying responsibilities at this point. Well, let's scan the horizon here. So tomorrow will be the big night as far as the Christmas Nights of Lights here at the Indiana State Fairgrounds. $1 from every car that shows up will be donated to the toy drive. We will shop with that to meet the needs of families with toys, gifts for the holiday season. This opens tonight at 6, tomorrow night at 6, and at 6 o'clock tonight, coming up, we'll talk about why the weather can actually enhance the experience here, rain or snow. Alyssa?
All right, looking forward to that, Kevin. And we are going to see some cold temperatures tonight. We're dropping into the 40s early this evening. By about 8 o'clock, we'll be into the mid-30s. And by tomorrow morning, much cooler start to our Saturday. We'll be into the 20s to start Saturday morning. So it's going to be a chilly start, but we're going to warm up fairly quickly. And that's because we have a low pressure system that's moving in tomorrow afternoon. That's going to bring us a little bit more moisture in the air. So it's going to feel a little bit warmer throughout the day. And then we are going to see those showers start to develop as well. And here's a look at the timing on that. Looks like about 1 or 2 o'clock we'll start to see those showers in the afternoon for southwest counties, really spreading into central Indiana by the early evening hours. And then the bulk of the system is going to move through overnight while most of us are sleeping. What you are going to notice, though, is those gusty winds overnight. So most of our system will move through overnight, looking at about a ½ an inch of rainfall for most locations. But look at this. By Sunday morning, 9 a.m., things are out of here, and that's clearing out and we're just going to be left with some gusty winds from that system. By tomorrow evening, we'll see those wind gusts close to 30 miles per hour, and then by early Sunday morning, that's when we're going to see the highest wind gusts, just as that system is picking up out of the area. Those will be about 40 to 45 mile per hour wind gusts. Behind that, some calmer conditions on the way to start next work week. So Saturday, those rain showers moving in late. Sunday, a little bit windy throughout the day, and then things clear out Monday and Tuesday with plenty of sunshine for next week.
Grocery shoppers are looking for more premium options. Research finds a change from the beginning of the pandemic when Americans stocked up on canned goods and household staples. Now demand is up for high-end coffees, cheeses, and frozen entrees. And food costs have jumped again, this time 2.4%. That's the biggest increase since the surge in May, tied to shortages because of the pandemic. Thanksgiving right around the corner, and many may choose to take their celebrations online. After the year we've had, virtual event really isn't new territory. But there are some things to keep in mind for a holiday event online. Virtual events experts at Eventbrite have some tips as we plan ahead. First, decide what platform you want to use. Zoom is better for smaller, more intimate events. If you're having a big blowout, Twitch or YouTube may be a better option. Also, try to send out an agenda in advance to help others plan ahead.
That will help your guests structure their home life so that they can tune into the parts of the experience that they're excited about and skip other things that might not fit with their day.
A few things you can include on your agenda are cocktail hours, streaming a meal together, and trivia and bingo games. In order to make sure everyone connects with one another, you could also set up breakout rooms. And if you really want to bring people together, you could send out party favors.
You can get your guests really involved by sending a tangible item to them in the mail ahead of time. And this can help create a physical connection. It can be anything from a Thanksgiving decoration, a little dessert, or maybe even ingredients for a DIY cocktail that you can make together.
Experts encourage setting up a festive dress code just to make the event feel real. And you can't run out of virtual space, so feel free to invite as many people as you would like. With healthcare costs on the rise, a growing number of Americans are throwing out the old way of seeing a doctor. They're turning to a membership model instead. A monthly or annual fee gets you direct access to a doctor, no insurance needed. As Usher Qureshi found, it's a model that some say cuts their medical costs.
I was just miserable.
20 years into her career, bogged down by red tape, too many patients, and long days,
the joy of medicine is gone, and then you're just doing paperwork.
Dr. Shaila Pai Verma was looking for a better way to practice medicine. So a year ago, she started a new primary care practice with a new business model.
The patient basically has a direct contract with the physician, and they take insurance companies out of it.
Patients pay a flat monthly or yearly fee. In exchange, they receive a broad range of primary care services and quick, unlimited access to their doctor via in-person office visits, phone, or by text.
Everyone wants everything immediate, right? And so I think this is it. This is it. You know, it's good, especially in this time, for people to have access.
Membership fees range from about $125 to $200 per month on average, about $250 less than having typical health insurance. Most patients still carry catastrophic coverage for emergency treatments and hospitalizations, but that insurance is usually only about $50 to $100 a month, meaning patients still save money. For Bonnie Michelli and her family, it was all about access.
With this, it's just so much easier to just know that I can contact directly here within a few hours for any issues that I'm having.
In late September, a bipartisan proposal was introduced in Congress that would expand access to the model and allow people to use their health savings account for direct primary care. Because they see fewer patients than traditional practices, some critics warn the model could worsen the shortage of primary care physicians, a trend already fueled by burnout. But according to a recent study, DPC members had 25% lower hospital admissions, and the cost of ER claims was reduced by 54%.
There's less ER visits and, better health care for the patient.
While there is still debate, for a growing number of Americans, it's becoming a simplified health insurance alternative.
Honestly, just so nice to know what I'm paying every month, or if you do the annual, what you're getting for that money, and you know exactly who to go to when you have a problem.
Reporting from Chicago, I'm Usher Qureshi.
Next in our lineup, there are concerns some gowns hospital staff use may be giving them a false sense of security. Why all of those gowns may not be meeting safety standards. We've heard about medical grade masks, especially from overseas, not meeting safety standards. Now a nonprofit is raising awareness about the same problem with some gowns. ECRI works with hospitals, the government, and insurance in several areas, including independent medical device evaluation. They got a request from a large Philadelphia client that bought a truckload of gowns labeled not for medical use. ECRI tested those and 34 other different gown models from a dozen other facilities across the country and found 52% of unlabeled gowns didn't meet the lowest level of protection set by the Association for the Advancement of Medical Instrumentation. While it's a relatively small sample size, it's still concerning.
So there's hundreds, if not thousands, of those suppliers out there. We were just very concerned when we saw those numbers that probably more of those non-traditional U.S. And the Chinese vendors are their gowns are probably not up to the standard the healthcare professional was expecting when they're putting it on.
While ECRI admits some shield is better than none and infection is unlikely through contaminated material getting on your clothes, it's more about a false sense of security.
The issue becomes when you think you're protected, it's leaking through, it's soiling your underlying garment. You take the gown off, you go to the next patient. There's a risk of cross-contamination of that patient.
The PPE shortage led to many facilities buying what they could. That doctor sees that as a homemade crisis due to a lack of coordinated distribution.
Everybody is trying to get as much as they can, hoarded to a certain extent, or quote unquote, and then creating more of an artificial shortage than it needs to be.
ECRI has resources available to anyone on its website that shows what PPE is available and needed. As nursing homes have had to shut their doors to visitors, families have felt shut out from loved ones. One woman came up with an idea that's now spread. Monday, how she got a job working in her mother's nursing home so she could be close by.
Let's take one more look at the 7-day forecast. Tomorrow we're in the 50s. That rain moves in late, windy on Sunday. Sunshine returns Monday, Tuesday, and Wednesday of next week. Then we're back in the 60s Thursday and Friday. The news at 6 starts right now.